everybody. Welcome to another episode of What a Hell of a Way to Dad. It is Francis, and with me today, I have somebody who reached out to us. We're veering away from DadChat, although I don't know. We didn't talk about if you're a dad or not, but we got reached out one day, one hopeful day. You know, I have always extended an invitation if you've got something that you want to talk about to come onto the show. And Dylan Kilby here reached out. Dylan reached out and told me that he is somebody who has been spent the last couple of years working in public health. And that is something I think is going to be pretty important to talk about, especially because I don't think really anybody understands public health unless you start working in it. And, you know, just a lot of inner workings there. So we've got Dylan here. Dylan, how are you doing today?
Hey, everyone. I'm doing great. Really excited to be here. It was fun seeing that my random email to A Hell of a Way to Dad got some interest and a response. So I'm, really stoked to be here. As Francis said, I am a public health and emergency management professional. I've been broadly working in the industry, and sometimes it feels weird to call it an industry, for the last 10 years, and excited to have a little chat.
Yeah, great. So let's first talk about what public health is, because I have a buddy who works in public health. He's a doctor, not a show him your rash kind of doctor, but you know, he got a degree in public health and safety and things like that. And I know he works in a college now and does teaching. So when you say public health, what is it that you do?
Man, what a great question. And we only have 45 minutes, not 2 years of public health to distill.
Hey man, there's always room for more podcasts out there.
Sure. I would say the goal of public health that I was described doing my Master's of Public Health at the University of Michigan about a decade ago is that public health stands in the way between the hospital and the community. And by that, I mean, we want to identify interventions. We want to facilitate networks to prevent people not necessarily from getting sick, but from acute illnesses.
From a technological standpoint, from somebody who works in IT, you want to act as that firewall. You want to be that buffer in between. And I get that. I've been trying to explain this to people at my work because we have a ticketing system. You need to have something like, I don't want people to go to the hospital, right? If in a perfect world, you never have to go to the emergency room. If you get the sniffles, you can go to urgent care or whatever. But like the emergency room should be for actual emergencies, right? In this perfect world where you have done everything that you can and everybody is happy and healthy, we don't need that. But unfortunately, people are going to continue to shoot fireworks out of their hands. So we will always need public safety out there.
Yeah, and I would also compound that a little bit by saying that public health has a variety of fields that are a part of it. So, for example, my background is in epidemiology, which you can broadly define as looking at the spatial and temporal distribution of disease. So there's an outbreak of Legionnaire's disease in Pennsylvania. How does this broadly fit into the network of the people that are coming there, certain socio-cultural traits, et cetera, so we can find ways to ensure that either this outbreak doesn't get even worse or find ways to mitigate the odds of those outbreaks happening again in the future. Whereas like my wife, we both have Masters of Public Health degrees, and she works broadly in health behavior, health education. So she works a lot with like college students, with sex, drugs, alcohol, sleep schedules is a really big part of health, especially student and adolescent health. There's a broad spectrum behind it, and it's about promoting the phrase promoting well-being might sound a little corporate, but that's exactly what it is. Identifying ways that we can facilitate the health of the community, because the health of the community influences the health of the individual.
Right. And I feel like this doesn't necessarily come down to just, am I sick or not? Or, you know, it comes down to, are the houses that are around me, are they well kept up? Are they livable? Are people healthy around me? Is it just a healthy neighborhood? Infrastructure goes into a lot of that as well. I'm sure we're going to talk about infrastructure, but like, you know, you don't think about like, my health is connected to like making sure that this hydroelectric dam still works, but it all gets connected up, right? Because it all affects us. So, so you've been working, you said about 6 years, right? So, in the beginning, kind of I guess first, when you started in public health, what was the what was your entry point? You've got this epidemiology. Did you get to start exactly with viruses on day one?
So interestingly enough, I did my master's of public health in epidemiology with a focus on risk science and human health from 2018 through 2020. So COVID occurred, for lack of better words, right at the end of my graduate school degree. So I had actually been, we call it deployed in the industry to the state of California to support the COVID-19 response while I was still finishing my master's of public health. Got thrown right into the fire at the very beginning.
Yeah, this is very reminiscent of like when 9/11 happened while I was in basic training, and you have that just you're just kind of tooling around. You're just like, oh, okay, I'm going to learn some things. I'm learning about viruses. This is fun. This is great. And it's like you are now the forefront, and everything is on fire, and you have to deal with this. Good luck. Yeah, enjoy.
Very, very distinctly remember being asked by a friend in December 2019, who is a medical doctor, was going through his training at the time. Hey, what do you think about this like COVID-19 thing they've been talking about? Do you think it's going to be that big of a deal? And I don't remember my response. I'm sure it was very funny in retrospect. But yeah, seeing January come around, February, some people are coughing in Seattle and California. And then early March comes around, and that's where shit starts hitting the fan. And if I recall correctly, I can't swear on this podcast, right?
No, you're good. It's fine.
All right, awesome.
We're all military salts here.
Perfect. Yeah. So like I said, I kind of got thrown right into the deep end at the very start. I was deployed to the state of California. I worked with the state of California, contracting and supporting the response for about 3 years. And from the very beginning, we were assessing health metrics, trying to figure out what is going on. A whole lot of epidemiology, and especially public health through the context of emergency management, which is my field, is all about the cliche of your known knowns, your unknown knowns, and trying to turn those unknown unknowns into the knowns as much as possible.
So, and that's, I guess, in that emerging kind of area there, were you also working, because, there's also got to be a public facing version to public health, right? So there's got to be all of these commercials, there's got to be posters, there's got to be things like that comes out. Do you get to be a part of that? Or are you just kind of staying behind the scenes and pushing out the information to people? When you were deployed to California and gathering information, what exactly was being done with that?
That's a great question. And it is, if I may ask Francis, before I answer that question, how much do you know about like the FEMA ICS incident command system and stuff like that?
I know that there is one because you just told me about it.
Sure. So I'll give a quick 60-second primer on ICS. So the way that the majority, actually, I shouldn't say the majority, the way that
what does ICS stand for?
Sure. So ICS stands for Incident Command System.
Okay.
The Incident Command System is the framework that is used throughout the United States to guide an organized response to theoretically any type of emergency or disaster in the United States. ICS is defined to be modular, so it can be used by like local jurisdictions, cities, counties, etc. And then it's designed to scale up to include state and federal partners, everyone from the top of FEMA to, again, your county emergency operations center is going to be operating through the incident command system.
Is this like a process? Is this a software? Is it like a binder that somebody has somewhere that you're supposed to flip through?
No, definitely part of many binders. ICS is a framework, is the best way to describe it, an operational organizational framework. So anyone who takes like a FEMA introduction to ICS course will learn about this as a framework for a response. So ICS, and I bring this up pertinent to your question about like data collection, management, the organization of a response, because ICS defines certain operational categories, you can kind of think about it, branches, so to speak, of the response. So you have like your planning branch, you have like your operations branch, et cetera. And these branches are collaborating in order to facilitate the response as best as possible. One such branch is going to be your public information officer, which is more or less exactly what it sounds like. The person who's responsible not only for managing and relating to the media, but also identifying ways to reach out to the public and then source feedback from the public. And at the risk of going on a tangent, I think one of the more professionally interesting aspects of something like COVID-19, if not public health, emergency management in general, is we saw a lot of disconnect between how public health departments were looking to communicate or looking to facilitate the response versus how emergency operations centers and like your Office of Emergency Services or whatever wanted to communicate and organize the response. A lot of this was more like organizational friction, more so than any actual disconnects with the messaging that the public might see. But I bring this up again just to impart upon the listeners that it's an organizational framework that has a lot of moving parts, to put it mildly. And the type of like public health information was usually organized by these officers with like public health subject matter experts and then distributed to the public that way. So as an example, if the state of California is going to say, hey, bars and restaurants can now do internal service because there was a period where their service was only allowed outdoors, then the public information officer would be the one who is like drafting the news reports, the press announcements, managing the media, et cetera, to make sure that that is as that is as consistent of a messaging as possible. Does that answer your question?
It does. And so I know that you, as you said, you work for a private firm and you were deployed out to work with the state. How is that? How is it different? Like, because the state, a state of California, you're not from California, right?
No, I actually live in Colorado.
Okay, so you're from Colorado, you get sent over there, but like, I would assume though there would be positions that you could be doing with the state or with the federal government as well. So I'm curious why the private route instead of the government route.
No, also a great question. And alluding to the first topic, which was like, what did the beginning of my public health career look like? I had actually gone to graduate school with the intention of working primarily with Native American communities in Alaska, where I had previously lived before starting my MPH. And as I got into grad school, I kind of pivoted more toward disaster type work, emergency management type work. I joke that I am a little bit of an adrenaline junkie, and I'd like to use that for good instead of evil. So my interest pivoted a bit that way. I would say before, or as I was in my final year of grad school, I was much more interested in doing more response type work. Like the CDC up until recently had an organization called the EIS, which stands for the Epidemiological Investigative Services. And these were individuals who would be sent to various states or governments, something along those lines, to basically research outbreaks of disease, especially more acute or more worrisome things like a Legionnaire's outbreak, as I said before, or something along those lines. So that's what I was interested in. Obviously, that's changed over the last couple of years for reasons that are very obvious to all of our listeners. I started working with this firm because when COVID-19 broke out, frankly, it was a once-in-a-lifetime opportunity to get in the ground floor on a type of this response. I like to use the phrase that it was professionally very exciting, even if it was personally horrifying. And I don't say that to minimize the trauma of COVID-19 in any way. Simply, it was literally a once-in-a-lifetime opportunity for someone like me to be a part of a pandemic response. So I started working with my firm, got in contact with them. I was deployed within 2 days of contacting them about a position to support the state of California's response. And I've really stayed with them ever since because we continue to do very interesting work, in my opinion. And I've not really had a reason to leave them. I'm sure other people who have worked in consultancy can tell you similarly, and that the number of interesting projects and the large variety of clients that I get to work with is very exciting, very fast moving, and very engaging.
Mm-hmm. I can see that. I mean, it seems like every day you get to kind of do detective work, whether it's epidemiologically or if you're, even if you're studying spreadsheets as you do now. Like I'm at a time in my life too where I essentially study spreadsheets, but like the way I study spreadsheets And I never thought that my brain would be like this, but it's like, no, I can actually like the guy watching The Matrix. He's like, no, I just see blonde, brunette, redhead. Like I'm getting that way with like information. It's like, but I know what everything here says, and I know exactly where it needs to go. So working, we're working on those spreadsheets, man. We definitely need it.
I know. I mentioned this in the green room before we started talking, or started recording. I joke that my job is probably not nearly as sexy as it sounds. I look at a lot of spreadsheets and I look at a lot of plans, but frankly, I think they're very interesting plans. And as cliche as it sounds, getting an email from a client who's a public health department within a county saying, like, you have manifestly helped us. Here is something we're doing with our hospitals or skilled nursing facilities that you provided us is an extremely good feeling. And it's what I chase in the field to this day.
Yeah. This is the thing. Our government would work perfectly if everybody could get a government job based on special interest. If everybody was just slightly on the spectrum and was just like, I really just love to learn about sewers and our entire sewer system, brother, I got jobs aplenty for you. Like I want you to be happy. Yeah. Like the same thing. It's like, I want to do public health. I want to do epidemiology. Like there's so many places, there's so many things inside of public health that you can do. Like, you're just talking about the PR side of it, and then the science side of it, and my friend who's an educator, the education side of it. So there's a lot of really cool things, the parts of it there that you can use. So you've been doing this for 6 years. So after COVID, I guess, I mean, we can't really say after COVID, where COVID is just kind of like a thing now that we deal with. But are there anything like, I mean, there's always kind of epidemiological things that are happening. Is there anything else that's kind of like on the horizon that you're keeping an eye on, or what is it now that we're kind of on the other side of COVID that you are filling your time with?
Yeah, I have two responses to that. The first is regarding COVID. You're absolutely right. The formal federal emergency disaster declaration ended in 2023. But of course, it's something that we're always going to be dealing with, especially when it comes to what we euphemistically call in my field vaccine hesitancy. So people not getting vaccines for one reason or another. It's going to be something that we're constantly going to have to live with as background radiation. As for the thing that I have my eyes on is a little something called dengue virus. So some of your listeners might be familiar with dengue fever, which is a mosquito-transmitted illness, or a vector-borne illness, as we call it, that primarily is associated with hot and humid places around the equator. You can imagine with a warming climate and a lot of U.S. infrastructure in some of our most populous cities being in the southern United States, that the climate is changing in a way that is very beneficial to the Anopheles mosquito that carries dengue, as well as concerns for dengue virus becoming endemic in the United States. Endemic simply means that this is a virus or an illness that is now a part naturally of the area. So, for example, I know that the Southern California Association of Governments, which broadly includes areas like Los Angeles, San Diego, San Bernardino, et cetera, are doing a lot of work right now to do dengue virus mitigation. And by that, we mean like identifying potential sources of stagnant water, looking at ways that, like, the climate is changing, that like the spatial distribution of dengue virus itself and the mosquito that carries it is coming upwards through Mexico and into, again, right now, primarily the southwestern United States. Some of you might also be familiar with like West Nile virus, Zika virus. These are all mosquito-borne illnesses that we are seeing greater number of outbreaks of, and we're worried about potentially being endemic. And then the other is one that I'm sure all of us have had way too many occurrences with, and that's ticks. Ticks and Lyme disease are a really big thing. If you look at the time progressed maps of Lyme disease progression through the United States, you can see a very clear westward trend within like the last 30 years, much less the last 50 years. The state of Michigan is a really good example. Lyme disease was nowhere in Michigan half a century ago. You might have the occasional aberrant case in like Southeast Michigan near the Ohio border. Cue your Ohio jokes here. And then you start seeing a westward expansion of Lyme disease's incidence over, again, the last 20 or so years. So now Lyme disease is occurring in almost every county in Michigan, whereas it never happened again, up until 20, 25 years ago. So those are the two things that I would say I'm most concerned about when it comes to specifically infectious disease in the United States.
Yeah, I spent some time in Honduras and I saw what dengue does, and there's no it's a virus, so there's no cure for it. There's not really anything that you can just pop these couple of things and you'll be fine. You just have to wait for your body to fight it off, which is not great. And it's mosquito borne. Like we just got to kill all the mosquitoes and be fine.
You know, it's funny you mentioned the kill all the mosquitoes part. For quite a while in the 1980s and 1990s, there were serious efforts to completely eliminate mosquito populations throughout southern Africa to reduce the spread of malaria. As you can imagine, it was not successful, but it was as simple as like genetically breeding certain types of female mosquitoes so that they would produce offspring, but their offspring would be sterile.
Yes.
What this actually ended up doing was just making it so that the mosquitoes that reproduced that didn't have this mutation were even more virulent, were spreading even more, because if you have a substantial portion of female mosquito populations that are having infertile children, well, that means the population pressure on mosquitoes to have a lot of children is going to be even stronger.
Oh no, they figured it out.
I know, right?
We got to bang our way back to the top of the food chain.
As someone who's lived in Alaska, you'd think those mosquitoes had brains.
Yeah. You a big fan of Northern Exposure?
Northern Exposure? What
you've never watched
it?
You spent time working with Native Americans in Alaska, and you've never watched Northern Exposure. It was this TV show from the 90s where this doctor gets assigned to a very small village up in Alaska. I can't remember the name of it, but it ran like 6 seasons. It's very funny. Like there's all kinds of characters up there, but like half of the people who live there are Native American, like the cast and everything. So it's very I'm surprised you've never heard of it. I think you'd like it.
I'm surprised no one ever mentioned it to me. I lived with a medical doctor in Alaska. I'm surprised we never watched it together.
Oh my God. You're probably going to watch it and be like, I've been there. I know these people. I've seen all of this stuff.
Well, my wife and I recently rewatched The Shining, and I haven't seen it since we moved to Colorado. And I was like, that's the Flatirons. Wait a second. I know where this is.
Yeah, let me tell you, watching Ozark, and none of it being shot in the Ozarks, but you only knowing that because you're in Missouri, and it's very painful. These are the wrong trees, but nobody wants to hear me say that, but they're the wrong trees, guys. We don't have those trees here.
I've got a close friend of mine who's that way. Whenever he hears bird sounds in TVs or movies, he's like, nope, that's wrong. That's not a robin.
I love it. I do that with bullets too. I had that problem with hearing somebody shooting an AK-47. I was like, that's not what an AK-47 sounds like. Sorry. So Dylan, you've been working on these things. You said you had some books. Talk about some books that you would recommend, because I'm always up for expanding my public health knowledge, but not in a scary way. Do you have non-scary books?
Oh yeah. It's funny you mentioned that. My wife and I, or the scary book aspect, I mean, my wife and I like to go on dates to bookstores where we will ask the other person to buy a book for us. So like my wife will say, oh, I'm interested in a book that has like XYZ genres or tropes or aspects of it. And what I usually tell my wife is, I would like a nature book, but please don't make it be about climate change because it feels like every nature book about climate change is terrifying. And as someone who lives in Colorado, spends a lot of time in the outdoors, works in public health and emergency management, I get my fill of climate change books. And I try to take the same approach to public health books. So I have 2 books that I'd like to recommend your audience. The first is called The Coming Plague, Newly Emerging Diseases in a World Out of Balance. This is written by the Pulitzer Prize winning author Laurie Garrett, who won her Pulitzer Prize for her work on reporting on Ebola outbreaks in Central Africa throughout the 1990s. Even though this book came out in, I believe, 1996 off the top of my head, it is an immensely readable, highly fascinating book that goes through each chapter being a different infectious disease outbreak. So this includes like the very, very earliest origins that we knew of at the time of like the HIV outbreak. It includes Ebola. It includes Legionnaire's disease, as I alluded to earlier. But most importantly, it also chronicles the evolution of CDC and its global health outbreak monitoring and surveillance is the phrase that we use, efforts. And I think it's a really good read in 2026 because 30 years later, we see a lot of changes occurring with CDC. A lot of people are concerned about CDC's relevance in an RFK Jr. headed up world. Trust me, I completely agree. I'll get real mad and all riled up if I go any further on that. But the end of this book and looks at a couple specific epidemiological intelligence officers and how they were pushed out of CDC and how the CDC that they were a part of, they no longer recognize. And I actually have a quote right here from Joe McCormick from March 1993. Joe McCormick was a part of a lot of the early Ebola outbreak and hemorrhagic fever outbreaks in Central Africa. He says, and I quote, "I don't even recognize the CDC anymore. It's a bunch of politicized pencil pushers who make all the decisions without ever hitting the ground, never going into the field, never seeing things up close. I'm sick of it. I quit." And it reminds me that the types of things we're experiencing now are not new, that the CDC and the United States' broader approaches and changing relationships to public health are things that are changing or that have always changed. They've always occurred. And I don't say that to mitigate what's going on right now within the Health and Human Services or the CDC by any stretch of the imagination, because it terrifies me as someone who's made this his career. But it helps remind me that this isn't the first time these organizational changes have occurred. And if we can get on the other side, we will get on the other side. It will get better, and we will have people like Joe McCormick back in these types of positions, making the right decisions. Laurie Garrett is also an incredibly good writer. There's a reason why she won the Pulitzer Prize, and you can really get a sense of the narrative of the evolution of these investigations into infectious disease and how it makes a better, more brighter world.
All right. And what's your second book?
The second book that I recommend is a book called Pax Americana. This is written by an author named Elizabeth Fenn, who created this book to look at smallpox outbreaks throughout the Revolutionary War. So it takes place approximately between 1775 and 1782. I think Dr. Fenn's thesis about smallpox's impact on the Revolutionary War is a little overstated. She goes very far to say that a lot of decisive battles or economic conditions within the burgeoning United States can be traced back to this epidemic. But I think it's a very important book because it really strikes back at the myth that is so common nowadays that public health quarantine, that public health interventions are anti-American in some way, or they're against American principles of freedom. Reading this book, you can really get a good understanding that we actually have quite a long history in this country of public health being seen as a patriotic duty amongst Americans. The founding fathers themselves were very concerned with disease in particular, and there's a really famous Ben Franklin quote about how his 5-year-old child died from smallpox in 1736, and he regretted that decision for the rest of his life not to get him inoculated against the disease. One of the more interesting aspects in this book is how quarantine and blockades, especially around Boston, were actively used by American troops to reduce the spread of the disease, with George Washington himself being one of the biggest proponents of quarantine and public health intervention as a way to protect the troops in fighting against the British. And most people don't know this, but the Public Health Service Corps is actually a uniformed service that was commissioned in 1798. And John Adams signed the Act for the Relief of Sick and Disabled Seamen, which started with Marine hospitals and then evolved into this broader service. So unless MAGA historians are going to start saying that John Adams of all people is woke, I think it's a very enlightening book and totally recommend it.
Probably all those. I mean, if they're saying that you should go get inoculated, then I can't think of anything more woke than that. Yeah, I do like the. I'm actually inoculated against smallpox. Funny enough, because the Army made us all get inoculated against it. But the idea, because George Washington, and you're a listener of Lions Led by Donkeys. We both know that the thing that kills, the thing that kills most soldiers up until like the 1900s, really up until World War I, was disease. And disease still killed a shitload of people during World War I. It's just artillery barrages were a lot better than they used to be. But it was, 9 times out of 10, you're going marching out. You might not even see a bullet fired before you get something shot at you. And, these these things have to exist. Public safety like this has to exist, because I think about like in the military, as everything comes back to the military for me, they have to write down for the cooks. It says, look, your hand washing stations need to be this close. Your latrines need to be this far away. They need to be this, this, and this. And there's all these things, and the sergeant has to come down and check mark all these things, because we've already done this, and we already know what yellow fever is, and we already know what dysentery is, and we don't want you to shit yourselves to death. So we're going to move the toilets further away from the food. We've learned this. But I will say Americans Americans can have these problems too, because we had to learn how to wash our hands twice, right? Like we had to learn to take, to fight scurvy twice, like take lemons on your ships. And then 20 years, 30 years later, people's like, why we got all these lemons? To get rid of the lemons.
And very, very famously, to your point about hand washing, when the first studies were done in the early 1800s about hand washing reducing the spread of disease, it was done with surgeons and hospitals. And for decades after this study came out, the surgeons took it very personally that their lack of hand washing of all things would be the reason people were dying on the operating table of sepsis. And again, to your point about the kitchen not being next to the bathroom, to put it euphemistically, the oral to fecal route, or I should say the fecal to oral route, is the most common way that a lot of diseases are spread. So anyone who's had kids, again, dads in the audience, hey, how you doing? I'll be there soon. Rotavirus is primarily spread from fecal to oral. So you're not washing your hands, you're not practicing safe food hygiene. That's what gets you. Dysentery, of course, to go back to the military.
Ooh, I've gotten that one before. I've gotten dysentery a couple of times. That's not a fun one to crawl to a hospital with. But again, also like completely crippled me. Like if I had to go do troop stuff on those days, then I would have been completely useless. So that public health, that public assistance kind of stuff is, I'm sorry, it's super necessary. I mean, you go back to polio. Like, they got Elvis to go on TV and say, get your fucking polio vaccine. Like we have to do these things because, and I don't want to say that like the average American is stupid, but they're just uninformed. And then somebody comes and lies to them, and you have to come behind that person and say, no, I understand that you can't see, that it looks like I'm just injecting you with a clear juice. And I understand that you have an 85 IQ. That's fine. You deserve everything that you want. You deserve to be happy and healthy and lead a rich and fulfilling life. But I need to squirt this stuff inside of you. Otherwise, you're going to die. No? All right. Well, I don't give a shit anymore.
It's really I keep using the phrase, it's interesting you bring this up, but it is interesting that you bring this up because one of the big criticisms toward public health, and especially public health communication and education throughout the COVID-19 response, was that there's a very paternalistic element to the public health intervention. And by that, I mean, like, you heard the phrase, trust the science everywhere. And the people that I was listening to, including family and friends who were starting to become more skeptical about like the vaccine's efficacy, was they felt like they were just being told, hey, trust me, everything's okay. Take this injection, blah, blah, blah. Don't worry your pretty little head about it. And I feel like a lot of Americans just don't know much about like, how does the immune system operate? How does a vaccine operate? And these are things that I think people from my profession, and I don't mean to shit talk anyone in particular, it's true. When you're an expert in your field, sometimes you forget what the average person doesn't know. And I think we can do a lot better at facilitating that education as much as possible, rather than just kind of assuming like, hey, it'll work. Trust me, it'll work. I mean, I can tell you that it works. You know that it works, Francis, but everyone else, just trust me, don't worry about it. So I feel like we're trying to get a little bit better about that. And we've had a real come to Jesus moment about that, again, kind of paternalistic attitude that pushed a lot of people away, combined with the federal government basically saying, hey, these vaccines are dumb. Don't take them at all. Don't trust them. I mean, I'm old. I'm not that old. I'm in my early 30s, but I'm old enough to remember when being anti-vax was considered weird hippie bullshit in the mid 2010s. And well, I wonder what happened 6 years ago that now made 40% of the population think otherwise. I'm telling you, man, I'm getting all riled up.
That's all right. Hey, look, the public health is important, and they are taking the health away from us. I mean, as you said, the CDC pretty much unrecognizable. I know we're pulling out of a lot of climate accords, and I don't want to get further into speculation, of like what's going to happen. Who fucking knows? Nobody knows. We're all flying straight towards the mountain together. We'll all find out when we crash into it what's going to happen. But I guess what do you see for yourself in the next couple of years? Like, so you're looking at spreadsheets now. Are you still working with the government of California?
I work with a variety of like smaller water districts, wastewater districts, as well as some cities and counties. So a lot of the work that I've been focusing right now is very local based. I very strongly believe that my approach to public health as a paradigm is that public health incorporates everything. As we said in the very beginning of this episode, public health isn't just about the disease that you currently have or that you might have. It's about healthy communities. It's about healthy infrastructure, healthy systems, all of these things that are a part of our collective nature as American citizens and as American immigrants, as American refugees, as anyone who decides to call this place home. So a lot of the work that I've been doing right now is in the field called hazard mitigation, which is broadly defined as working with cities, counties, et cetera, to identify natural or human-caused disasters and ways that we can build healthier infrastructure to mitigate those impacts as best we can. So like, what the hell do I mean by that? A lot of my work was in California, as I keep saying. So wildfires are a really big part of that. What can we do to help a city in the San Francisco Bay Area reduce the impact of a wildfire that will occur one day? Could be this year, it could be 10 years from now, so that it isn't as harmful to that population. So that's what we're primarily doing now in my field. It's, as I keep saying, looking at 250 to 300 page reports, but these reports all identify the vulnerabilities to the hazard as well as the actions that these local communities can take to mitigate those hazards.
So can take, but do they take them?
It's that's the crux.
That's it, right. This is the thing.
Yeah.
You're doing great consulting work, but and then you hand in the report, and you're just like, all right, here it is. It's going to cost you $5 million to for this place to not fall into the ocean if a earthquake hits. And it's like, well, I mean, I don't live here, so I don't care if it falls in. I guess like when you hand these things off, how much of this implementation is being done? Yeah,
it's a great question, and quite frankly, it is a very fair criticism of consulting in general. One of the reasons that I've stayed with this firm for as long as I have is that I don't want to feel like I am just giving someone a report that checks off a box for federal or state funding. It goes on a shelf for 5 years, and then it's only brought up when the next thing is when the next iteration of the plan needs to be updated. Like, to me, it's both not fulfilling and it's not actually supporting the community. Hazard mitigation plans, and that is a specific phrase that is used by FEMA, are used to get funding for certain projects that are that have state and federal grants that are applicable to them. So I would say that we are trying our best to work with the communities we think will really affect a change and demonstrating to them, like, we don't want this just to check off a box. One of my clients recently used the phrase that they want it to be a living document. And I think that's really applicable for how I think, broadly speaking, public health and emergency management together as two fields can work with those communities as best as possible and as I keep saying, affect a meaningful change for the communities.
So I guess going forward, what do you hope to do? Like when you're retired, from the public health services, what are you hoping your big legacy is?
Oh man,
that's right. You didn't think you're in your early 30s, and I'm asking you to think about your 70s now.
Well, hopefully we'll still live in Colorado, and I can spend a whole lot of time climbing mountains. I would say that it's cliche to say that you want to feel like the things you do matter, but I do genuinely want to see my communities be healthier. It feels a little awkward to say because I don't want people to think that I'm trying to talk good about myself or that I'm some white savior coming in and telling all these communities, hey, this is what you actually need to be doing. It's more, the best times that I've ever had in my career is when I feel like it's been a conversation between myself and the population that we're serving with a really big emphasis on the word serve. Public health should not be a field that is talking down to people. It shouldn't be a field that treats populations as if they are a problem that needs to be solved, because it's not. And if you do talk to people that way, they're going to fucking hate you. They're going to think you're the biggest dick in the world, and you're not going to solve any of these quote unquote problems that you might see.
Yeah, you and I have that same problem, right? Because I know you were talking about how the COVID outbreak had that same, like, this is very interesting from a professional standpoint, but it's horrifying in every other way. But like, as somebody who's interested in this, because like, as somebody who watches a lot of combat footage and stuff, I get that. Like, this is horrifying. I wish it didn't have to happen. But like, I actually understand what's happening and kind of am, you know, there's something that does it for me here. But at least you're doing something good with it. You know, you get thrown into something like COVID, and it's not like you're trying to sell me a bunch of N95 masks that don't actually exist. You're trying to say like, look at everybody's pooping over here and it's full of COVID. This is a problem. You know, we have to, I don't know. You said you're working with wastewater. I know that the testing the wastewater is a big part of it, but you know, it's very important to have that. And so I'm glad that you do it. Are you back in Colorado now?
Yeah, but first off, I just want to say that's very kind of you to say. I do live in Colorado now. We're hoping to stay. We've kind of, as I've alluded to throughout this episode, we've moved around a lot, my wife and I, and our goal is to not move anymore. I do want to quickly go back, though, to your point about like watching combat footage, for example. One of the things that I was told on my very first day with the COVID-19 response is that you are going to be seeing people who are having the worst day of their entire life. And for you, it will be a Wednesday. And I think that's very important to remember. We are working with people who are experiencing life-changing, horrible occurrences. And we should never take that for granted. We should never take it back as a job. I don't want to say that like public health is this higher calling, it's this vocation, and I'm such a beautiful person for thinking it. It's just the truth. I would eventually like to see myself evolve more into a direct response role. So for example, I'm very interested in search and rescue. I'm a pretty active mountaineer and alpinist within the Sierra Nevada community as well as the Colorado community. And throughout the search and rescue training aspect, something that is constantly beat over into the brains is that like you're going to one day give the news to somebody that their spouse's response is now a recovery. And never forget how that news is going to impact someone else.
Mm-hmm. Well, Dylan, thank you so much for coming on. I'm going to have all of the books that you mentioned linked down below. Why don't you tell people where they can follow you?
Sure. I don't have too much of an internet presence, but if you want to follow me on Instagram, you can go to sunbleached_summits. I don't post too much about public health there, but if you're interested in some other books I think are cool, or if you want to see cool mountain photos, you can definitely get in contact with me there. I'm also more than happy to have more of these conversations with anyone who's interested in some of the things that I've shared today. And for those who are active on the Discord, you can find me at summit_fever_dreams. That's Summit Fever Dreams, which is an excellent pun. And I wish I had thought of it 5 years earlier.
Well, Dylan, thank you so much. Everybody, if you are listening and you're wondering about that Discord, if you are a member of the What a Hell of a Way to Dad Patreon, you will get direct access to that, as well as Joe's podcast, but Joe can advertise his own podcast if he wants on the show. Dylan, thank you so much for joining us. Everybody, thank you for listening, and we will talk to you next week.
My pleasure. Take care, everyone.